The next part is that we've got a panel, and I'd like to ask David to come up, Assistant Secretary, Immunisation Access and Engagement, Branch Department, Health and Disability. Dr. Sarah has been giving us a update on the vaccines in the corner there. A general practitioner, every letter in the world after a name, bit of dermatology, certified travel health. So that means she travels healthy, I think. Tracy, Ivy, practice nurse, Telegraph Road Clinic, Bracken Ridge, thank you. Anna, thank you. Get you back on the stage, thank you. Melanie, thank you very much, who's Director of the Australian Immunisation Register. So we're absolutely thrilled to have someone who has hands-on experience with AIR to actually talk to us about how we use it, how we don't use it, what could be better. Has everyone got their microphone and everyone's... So you can share it, so you're good. So maybe we can start by maybe giving a 2 or 3 minute summary of who you are, what and what you'd like to say, and then we'll start back with some questions. And so we've got half an hour to round up the whole session, and thank you.
Tracy Ivy, registered nurse, nurse immuniser, work in GP practice though. Of course, it's disappointing to be a nurse immuniser but unable to immunise unless under a GP direction. As I think we talked about earlier, it'd be nice if we had a more open role. I'm passionate about immunisation, especially for First Nations.
Hi, I'm Anna and we met earlier, so thanks for having me back up. I am passionate all things immunisation, but I'm excited for this session because I think there is some great opportunity to integrate AIR into our data and, our software and see where that can go. So, yeah.
Thanks. As you know, my name's David and my responsibilities broadly are to lead access and engagement for all immunisation activities for the Department of Health, Disability and Ageing. That means, in addition to what we were talking about this morning from the immunisation strategy and its implementation plan, I also have an area that does a lot of comms activities, engagement at a local level, deals a lot with priority population. So when you have a look at that immunisation strategy and there's I think it's 18 or 19 different priority populations that are listed under that, we do a lot of work in that space as well. I won't cover the immunisation register because Melanie will talk about that. But we also have the function, if you like, that gets the data back from Services Australia that's recorded in the immunisation register, and we make decisions about that, and we publish a range of information in relation to the data that comes out of the AIR. So really, from my position here on the panel this afternoon is to talk about the information actually that goes into the AIR. It's really important in terms of the accuracy of that because of what we bring out and then what we actually use it for. So it's not just about that high-level reporting of coverage rates that you will see in the media or on the websites and that sort of thing if you look it up. It is used a lot by academics in terms of research, and so being as accurate as possible gives the best possible outputs, if you like, to that research, and really has a kind of a much broader benefit from that point in time. But Melanie.
Thanks, David. So Melanie Quinn. My team are responsible for the collection and use of data in the Australian Immunisation Register. So our department owns the register. Services Australia administer the register on our behalf, so they do the day-to-day kind of operations of the register and system enhancements. And then we work with software vendors, obviously, to integrate with your clinical software or practice management software products. We work really closely with ATAGI, NCIS, and a range of other kind of experts to kind of make sure that the AIR is up to date and reflects the latest clinical advice. But yeah, happy to hear some feedback today.
Hello, Sarah, Brisbane-based GP and travel doctor. I'm an Immunisation Coalition member. The main reason I'm here is really just to be a bit of a GP voice. I've canvassed a lot of my colleagues' opinions and hope to share our wish list with what we would like to see make happen with our best practice medical director software, Australian Immunisation Register sort of integration. But a lot of this work stemmed from me wanting to be lazy. I thought if I can work a lot in health prevention and stop people getting sick, maybe I'll see less patients and I'll have more time to travel and go on holidays. But I found it's been very busy. We've got a very well-funded NIP, and I'd like to see the vaccination rates go up and get them into arms.
Do you want to
you
throw
for
the first
being here.
question? Do you want to put your question, start with a question from you? Yeah.
From me? Okay. So there's a Facebook group called GPs Down Under, and there's 11,800 members. Don't feel overwhelmed. There's a wish list that we would like, and the big one that we hear about is a one-click button to download the vaccines that are already on the immunisation register to go into our practice software. Now, I'm mindful that a lot of this is not AIR, it's not on your end. We did desperately try to invite the best practice medical director people to come to this meeting, but I think there's a reason they haven't turned up. Maybe it's quite an insurmountable task, rather than clicking one vaccine each at a time. I know that this is something shared by some of the nurses that I've spoken to because they use similar software. But let me start with maybe a question. One question that came up was, there's a comment in the AIR that will come up, for example, no vaccinations are due for this individual. And they were citing a 5-year-old who last had their flu vaccine in 2022. So they're up to date for all the NIP funded no jab, no play, no jab, no pay vaccines. But where does that leave you with the AIR? Would you be at risk of exposure to legal claims if that patient were to come to harm due to this misleading advice where flu vaccines are recommended for everyone over the age of 6 months, especially for children under 5? Big question.
So I think the tricky thing with flu vaccinations is that they're seasonal. So when we look at due and overdue rules that display a status, it's usually based on a person's age, their Indigenous status, or other kind of factors. But for the flu vaccines, we've always had difficulty about when does a person become due, when do they become overdue, and when do you take it off? So we're actually working with Services Australia at the moment about what options we can implement, kind of hoping to have something in place for next flu season, as well as potentially canvassing ideas for COVID vaccines as well. Again, with the COVID schedule, it's been quite unstable. The recommendations have been changing regularly over the years, but we're kind of at a place now where hopefully it's landed and it'll stay. The latest advice from ATAGI will stay like that, and we'll be able to implement those notifications. The statement about whether you're up to date for a vaccine is really, it goes back to when it was a childhood register. So it really relates to your status kind of for no jab, no pay legislation, and whether you're up to date for the schedule under the family assistance determinations. So that is also something that we're looking to update.
So-
There is a kind of
So
statement.
yeah, in fairness to the GPs, they're sort of saying the computer says no or the computer says yes when the computer's out of date and
Yeah.
irrelevant. And I guess they're looking for some help to make it current rather than to have the anomalies like in the past where Menc was recommended, but it wasn't part of the no jab, no pay. And so that's out of sync. So ATAGI recommendations funding is out of sync.
Yeah, so we are updating these kind of issues that have been raised as we're coming across them. We have just updated Menc, which is great. But I think that the statement on the kind of note down the bottom of the statement tells you that this is what's
Tell the
included.
GPs to read the fine print.
Right.
Shut up and read the fine print.
No, that's fine.
Sarah,
So
tell your mates. Yeah.
we are looking to update it. We're working with Services Australia at the moment.
I would just say that unfortunately you don't put in the First Nations ones when they're overdue. I do understand that not all states have the same program, which could be tricky, but I feel like it's really important when we're trying to improve the rates and close the gaps.
Yes. So again, we just made some enhancements to the air to try and introduce a First Nations schedule for pneumococcal, given the recent changes to the program where it became national, that additional dose. We broke the air. I'll just be temporarily, we broke the air for a second. What we had done is recognise that additional dose that was required, had notifications set up to send to First Nations or parents of First Nations children. But there was kind of a technical issue. The air was built in 1996. It's really old infrastructure, so sometimes we have unintended consequences. But we're working with Services Australia and we're hoping to have that kind of back up and running in the near future, noting that it really is important for us to be notifying those First Nations parents that their children require those additional doses.
I think an approach that we've been doing, I guess, as in my role, we're talking about for the PSA, we're talking to our members about it's a tool that's not yet quite there. Like it's a great help. We're excited where it will be, and I think we're going to touch on AI soon, and the potential for these things. Well, this is another really great potential that is being built. And I think the feedback, like as long as we can keep, having an open dialogue going, hey, this is not quite working. What I took out of that though is I loved how responsive you are and you're aware of it and that you're endeavouring to get there, but it isn't yet where you can just rely on it. So it's, robots aren't coming for our jobs. Like we still need to use it as that baseline, but also just know that we've got to, like something like the flu, it's just flagging, hey, are you aware of? Hey, we are back little ducks in the water.
I think Melanie and I have conversations with people all the time about things they would love to be able to do with the air. As Melanie said, it's old infrastructure, so it's not necessarily easy to quickly or cheaply implement changes. But whatever you can think of as a request to make an improvement to the air, I can guarantee it's probably already on one of Melanie's lists somewhere back in the office. There is a lot of stuff we'd love to do. We would like over time to
Can I stop you there and you tell us the 3 things you'd like done from this list sitting on Melanie's desk, and we'll contemplate them while you continue. So what are the top 3 things?
Well, I think the first thing, and I'll ask Melanie to jump in, but I think the first thing is those additional electronic reminders and notifications to people. So whether that's via SMS or via other push notifications that come out from apps and that sort of thing, to be able to, particularly in some ways, it's more difficult for the childhood schedule because there's so many vaccines on the childhood schedule, but in some ways it's easier because of from a privacy perspective and the use of Medicare data that you can easily send it to the parent or guardian. When the kids get a bit older, there's some other barriers in terms of the use of Medicare data. So first of all, the electronic reminders. Letters are just not as effective these days. People don't get many letters and they don't check their mailbox all that often. So something electronic there. In relation to due and overdue rules, like Damon was talking earlier about that healthy aging kind of passport. If you also had, something similar for due and overdue rules that would trigger a reminder for respiratory illness, respiratory vaccines at the start of high risk seasons for people when they're eligible for those NIP vaccines, something like that would be fantastic as well. We'd love to be able to do that. And I'm sure Melanie probably has other suggestions.
You probably just ticked off my top 2. Like we said, the SMS notifications to complement the existing letters is the dream. We've been kind of working behind the scenes on that for a long time. As David mentioned, the link to Medicare data makes it a bit complicated in terms of privacy. And then these flu notifications, like we've heard this feedback for a long time. And I'm really excited that we're getting really close to having potentially a solution available to be able to do that.
I'll add one more.
So online, if people want to send in questions, we're noting them as well. Thanks, Sarah.
If it's not already on Melanie's list, we do have another wish list item. If we're able to add things like positive serology results that are confirmed on pathology testing, say that they've had immunity to varicella or measles, and it might mean that future providers won't need to give boosters as concrete proof that they've already had protection.
I think that you can add serology. Oh, okay, yeah, sorry. Pharmacists.
I would love to see it though.
Yes. Sorry, I missed that key nuance. So who can add a natural immunity to the air is defined in legislation. So legislation is very tricky to change, time consuming, but we are looking at it. We're also looking at expanding who can report a medical contraindication to the air. So those two go hand in hand. We've worked with ATAGI, we've got the list ready to go, but like I said, it's legislated. So what we're kind of thinking about doing is pulling it out of the legislation, putting it in the rules. So if we're in another pandemic, it would be easier to change rather than having to change legislation.
So is there a way for the doctors down under to know that there's somewhere to send this stuff? So rather than Sarah having to wait until she sees you here to pass on the list, or is there some number or regulation where legitimate concerns, questions and queries can actually be sent?
Yes, we have an inquiries box, immunisation.registers@health.gov.au. I'm happy to provide that email afterward.
Okay, and Immunisation Coalition love to help you make sure that that communications, so we know what the issues are and help you solve them, because everyone's on the same page. Yeah. Any other questions from the room? Otherwise, I'll hand it back to the panel, and Sarah's got her other list of questions, or Melanie. And Anna, do you want to?
Rod,
I do have a
Rod, I got a
wish, but I don't know if this is you, but you can direct me. I know for us at the PSA, we love to give up-to-date information so we can get our members or our pharmacists to, you know, focus where they need to. I know we get a weekly flu update each sort of week with what's been given. Is there a way to get more? Like, so if we know that, say, you know, like I feel like we're waiting for interim data reports a lot. And so therefore we're not really proactive in response. It's more like, oh, well, last season, but that's kind of past. So again, I did confess that I don't have a lot of IT, so I don't know how hard these things are, but it would be amazing to have, hey, we can see an epidemic happening here, but we can also see vaccination rates are here, or yeah, I guess you know the question. Yeah.
I'm not sure we will get to the point in time where we're able to pull out live data in terms of the sort of extent that you're looking at there. But what we have a data modernization project that's underway right now. And what that will do is make a lot of things that we sort of publish on, you know, maybe a quarterly or 6-monthly basis, put it into public dashboards where people can go in, you know, if you like, manipulate that data cube. There's obviously some, you know, small data cells need to be kind of repressed, so we're not kind of impinging on anyone's privacy. But the availability of largely, whether that's, you know, monthly or quarterly, I'm not sure what the draw is going to be out of the air, but to have that readily available, whether it's going in and having a look at all childhood immunisations, whether it's just by respiratory diseases or whatever the case may be. But the aim is to have much more regularly updated and readily available information published publicly.
And can that extend to, say, a nursing home getting data on all of their patients rather than having to get them one at a time? And is there any sort of grouping or access or state?
At this point in time, that isn't possible because the air doesn't record that information. That would be part of a substantial redevelopment of the air to make, if you like, aged care home specific reports available.
Sarah, another question, because there's some. What about state variations? So that you know, Queensland introduced a vaccine, or someone else has introduced a vaccine. So MenB was a great classic example. ACWI became state by state introduction. So due and overdue. And the other question was, do every 65-year-old plus who hasn't had their shingles get a weekly reminder that they're not up to date, or is it only on their birthdays?
I think we might come a cropper of spam laws if we did that.
So in relation to shingles, We send reminder letters at various points. I think 60 of 50, 50 for First Nations people, 65, 70, and 75. So if a person's not up to date, they'll get a letter. It'll also appear on their air record for a provider. So when they pull it up, it'll say Mulaney is due for her shingles vaccination on this date. We just, interestingly, we had the reminder letters on hold for a while during the rollout of the shingles program due to the demand. We didn't want everyone rushing out to try and get vaccinated all at once. So we've just done an evaluation from when we turned the letters back on, and we found that around 35% of people took action to become vaccinated within 8 weeks of receiving a letter. So that was really positive kind of data. And then, like we spoke about before, if we have SMS reminders to kind of complement those letters, we should see really good results. What was the first part of the question?
State-based variation. So
yeah.
each state recommends the vaccines, and so a MenB program started in South Australia. I'm not quite sure what Queensland's, but they've got MenB, but I'm not sure have they got an adolescent program. So
Yeah.
they'll be due in the States. So due and overdue will it depend on your postcode?
We can only do due and overdue rules for national.
It's a policy
program.
decision, not as a.
It's a system restriction. And then in
Computer
addition to
says
that,
no,
it
that's
gets a bit complicated where you have people moving between different states and territories. So it has been considered. We've worked with the jurisdictions to kind of look at possible options, but it's just been agreed at this stage that it's
Yeah.
not
So
feasible.
the providers are telling us that they're the group that need to be carefully monitored, because if someone goes from interstate, they might have had B but missed on the others because they may not have had ACWY. So that it's actually more important to have those groups that are difficult than it is perhaps to have the easy ones.
Yeah.
Not going to happen. So blame the
at this
states for
stage.
that one. Let's kick that one,
Not at-
make that a state problem. And so again, if 2/3 of the population haven't had their shingles, and we know it's going to last 11, 12, 15 years, and it started 2 years ago. So why don't we start the next season by writing to everyone who hasn't had it? I mean, is that the sort of response that we might better see, sort of ad hoc and targeted programs when we know we've got vaccines and we've not got an age group? So do you have any thoughts on that type of program?
I'm not sure the viability of writing to everyone in those circumstances, but certainly we run a number of campaigns on a regular basis to provide information to, if you like, those target cohorts to have a chat with their, their GP or their pharmacist about getting vaccinated for, in this case, shingles.
Any other questions? I think there was one in the front here, Chris. No, you weren't. Oh, Anna. So
I thought you said don't you have a question for Anna?
So Sarah.
So sometimes I see there was an incorrect brand that was entered, and correcting mistakes can be quite difficult. Is there a way to make that easier? Sometimes when providers have tried to phone, there's no one available to answer, and changing it on the system is challenging. Is that on your current list?
Yes, it's something that's been discussed with Services Australia. It is on the list. I won't have a solution for you right now, but yes, something that we're thinking about.
Yeah, I think I'd probably comment as well that from my sort of earlier opening remarks about the importance of getting the most accurate information in the air that's possible. We had quite a number of follow-ups following the introduction of the maternal RSV vaccine. We had, that maternal flag that was ticked for 50-year-old men who are highly unlikely to be pregnant. We've had, and some of the defaults in the system, which is why I would really love one of the software providers to be here. But sometimes the defaults in the system where people are moving through quickly to tick boxes or check other things to provide those updates. I think we've got a number of vaccines recorded in the air every year for things that aren't even available in the country and haven't been used for quite some time. So clearly that's going to distort the numbers a little bit and make it kind of more difficult to really trust that information later on, to not just for research purposes, but also for the government to make policy decisions on what should happen or what the future of some of the immunisation programs should be.
Sarah, sorry, you had another?
What vaccines are these that you're seeing that you don't think are in the country?
ACAM 2000.
Ah, okay.
So we had 20,000 ACAM 2000 vaccinations reported to the air over the last few years. And it turns out it was an issue with software that was defaulting to ACAM. So basically what it's meant is Services Australia have had to do outreach to try and correct those 20,000 records, which has been a huge undertaking because they have to, it was thousands of providers as well that they're having to contact. So I think we've provided that feedback and we understand that the issue was resolved and that functionality has been removed where it's defaulting, which was great. We also put in a range of warnings this year, which has been fantastic in terms of off-label reports. So things like where you have flu vaccines used for 65-year-olds being reported as given to 5-year-olds. Over the past few years, we've had huge numbers, but we introduced these validation warnings this year to kind of say, are you sure that this is correct? Same with the pregnant men, the pregnant children, and the pregnant older Australians. Are you sure this person's really pregnant? And we've seen like the data quality has improved significantly, which is awesome. But we also understand, and I'd be happy to hear from anyone in the room, that some software products don't display those warnings. They kind of, the software vendors in creating efficiencies for doctors and reducing the number of clicks, auto click the warning before it appears. So I'm interested to hear, has anyone seen a warning that says, are you sure this 5-year-old's pregnant? I did. Fantastic. Okay, great.
And most of my 70-year-olds comes up with a warning to say, you sure they're not pregnant before I prescribe the medication? So sometimes it's got the reverse. So Sarah, you had a question, then I'll get Chris to answer.
Not a question, but I did want to say in general, most people are very appreciative and feeling very fortunate that we have air at all, because before it was either nothing, and then we had the ACIR, and then in September 2016, I remember thinking, my goodness, there's an air. And then to see that a lot of it extended beyond Zostavax to a lot of other vaccines, and it's just made a lot of our lives easier, especially in the travel vaccination space. But I imagine it's going to be the same for many of our nursing colleagues and pharmacists as well. So in general, thank you very much, because the
Has been
program
a wish that we've had for many years.
and the wish list is it's very nice, but what we have is amazing.
Tracy, I think, and then Chris. Yeah.
Yeah, I was just going to say, having used both best practice and medical director, best practice is a lot better as far as entering vaccinations. And if you do identify someone as being First Nations, it will pop up with those vaccines as well. Where I am now, we're using medical director. It's very clunky, very ordinary, and doesn't have any of those nice things. So when I started at my practice now, there was a lot of First Nation children who hadn't had their extra vaccinations, but I'm fixing that.
Chris?
Oh, look, it was on accuracy, and I think you pretty much addressed that. Is that you've got a room full of providers? Is that what do you want to tell us that you need us to do better? It does sound a lot of the defaults in software could be part of the solution, but is there any way that you think that could be useful to share that communication with us so we can share it with other providers to improve the quality of data, and to even hear that some of those defaults are happening? It could be helpful for us to disseminate that as well.
I guess, just the regular feedback, probably both ways. Feedback to your software vendor people as well would be great about things that you find work and that don't work. I think we hear a lot, the air doesn't do this or the air doesn't do that, but it actually does. It's the software that's not doing it. So I guess you can provide your feedback on our behalf.
Yeah, so that would be useful because we're not sure where, and at the moment it looks like, yeah. So
Yeah.
I've had someone ask me a question what about artificial intelligence and where's that going to fit? So do you have in your dreams and future either proofing or preventing that there's going to be any AI features that you anticipate bringing on to air? Is that just a dream, or is it reality, or is it complete rubbish, David or Eleni?
I think that any use of AI in that space is quite a long way away. As we said, it's an old system on old infrastructure. It does need some redevelopment to take place over the next few years and expand the capability of it. But I think probably the use of AI is more in relation to the research fields and the academics who are using the data than it is specifically for use in the air as it is right now.
The next question I've got is for research. What are the recommendations and limitations for a group to get data if they're looking at research? Is it open to everyone, or is it only institutions, or can someone make specific inquiries to be able to access a group for research?
It is definitely not open for everyone because there's a lot of sensitive information within there. There is a gov to gov feed for the air where information's made available directly to the states and territories for them to use for local planning purposes. The AIHW is able to access that air feed as well. Even NCs don't get the full feed at this point in time, although we're kind of working on making arrangements with them. But broadly, there are very strict release policies on what the data can be used for and who it can be released to. There's a really significant and detailed 6-point assessment process before any of that information is used outside of the department. So we frequently do say yes for research activities.
If someone's got an interest in research, then feel free to apply and then see what criteria and it can be considered. There's no
Absolutely.
guarantee it'll be given, but don't be afraid of asking.
That's right, yep.
That's fantastic, David. Thank you. Any other final questions? I've run out of the questions that I've been given on the floor here. Everyone's saying home time. Yeah, good. Thank you. Thank you. And down the end there, thank you very much. So any final wrap up from the floor, because we're just about to finish? But no, thank you very much. Thanks everyone for coming. Thanks for an amazing opportunity to talk to you, and thanks everyone